Hello, and welcome to this introductory presentation about MO1028 Child Health Conditions. This module will build your rural generalist knowledge and skills in service provision for child clients experiencing a child health condition and their families who are living in rural and remote communities. The module will provide the opportunity for you to explore two child health conditions, enhancing your knowledge and skills in assessment, clinical reasoning, and care planning while using family-centred and multi or interprofessional team approaches. The intended learning outcome for this module is that you'll be able to combine advanced knowledge of childhood conditions and assessment with clinical reasoning skills to formulate and communicate family-centred care plans designed to optimise care in the rural and/or remote setting in accordance with best practice guidelines and local service strategic intent. The module goes for 6 weeks with 22 hours expected workload. You can see the weekly topics here. In week 1, learn about child health conditions. You'll select 2 child health conditions to explore before identifying a client and preparing for assessment item 1. You'll then test your knowledge of these conditions before learning more about them, filling in your knowledge gaps. In week 2, assessment, you'll locate assessment evidence for your 2 selected conditions from the perspective of multiple professions before closely reviewing screening and assessment options. In week 3, assessment continued, you'll refresh your understanding of the family-centred approach, discuss assessment options and findings with your experienced paediatric therapist before reflecting upon your assessment practice and submitting the first 3 weeks of your module workbook to gain feedback on how you are going so far. In week 4, intervention, you'll find and review evidence for the interventions relevant to your current client or historic case and their condition before making contact with the health professional or professionals identified in week 1 to discuss interventions from their professional perspective. You'll also identify services relevant to your context and client. In week 5, variation, you'll compare your care plan with evidence-based guidelines before troubleshooting the complexities of delivering evidence-based healthcare. In week 6, care planning, you'll discuss your care plan with your experienced paediatric therapist and make adjustments to your plan based on their feedback. You'll then draft and record yourself simulating the presentation of the care plan to your child's parent or guardian via telehealth in the form of a scripted monologue before submitting assessment item 1. A single assessment task is due at the end of the module in week 6. The task is a written care plan for a client from your current or historic caseload and an oral presentation based on the care plan, which you will deliver in a simulated telehealth discussion with your client's parent or guardian, during which you'll present and explore the care plan. You'll also have the opportunity to submit a formative piece of work at the end of week 3. This is your module workbook, which is not marked, but will give you some feedback on how you are going. We've built in some opportunities for you to interact with the content, the module coordinator, and other participants who are taking the module at the same time. There are learning activities, which include contributing to online discussions. This provides a chance and an expectation for you to swap professional insights with others who may be from the same or other health professions. This mutual exchange of knowledge is the basis of successful collaborative team practice, so we hope you'll join in. You'll find the module outline in the Start Here folder. It contains your module coordinator's contact information, all the details of the assessment task and marking criteria, information about applying for extensions, any module prerequisites, and the module calendar. Please don't hesitate to get in touch for any questions or concerns, and enjoy the module.